Welcome back to another Deep Dive Med. Today we're taking a deep dive into pharmacology for respiratory diseases.
Think of it as a crash course in how those inhalers and medications work.
You know how they do their magic on your lungs? We're going to uncover the why behind their use
The science behind it.
and what you should be aware of for your safety.
Absolutely.
Ready to decode the language of drugs together?
Absolutely.
Let's start by defining what pharmacology is.
Yeah, that's a big word.
It's a pretty big word, but it is the study of drugs,
Yeah.
how they're made, what they do to our body, how our bodies use them, the whole 9 yards.
Yeah.
And today, we're focusing on breathing,
So that means pharmacotherapy,
pharmacotherapy.
a fancy word for using medications to treat diseases, specifically respiratory diseases in this case.
Got it. So it's not as simple as just popping pills.
No, not at all.
Disease management is about the whole picture.
The whole picture. Medications are important, but so are lifestyle changes, therapies, really understanding what's going on in your body.
So let's say scientists have discovered a potential new drug for asthma. It doesn't just appear on pharmacy shelves overnight, right?
No, definitely not.
It's got to go through a whole process.
Yeah.
And the FDA is kind of the gatekeeper.
Right, the FDA, the Food and Drug Administration.
Yeah.
They're the quality control, making sure any new drug is safe and effective before it reaches the patient.
It's kind of mind-blowing how many steps are involved. So many drugs are first tested on animals, and then if that goes well, there's 3 phases of human trials. It takes years.
Yeah, it's a meticulous process.
Yeah.
But it's how we ensure that the medications we use are as safe and effective as possible.
Wow.
The FDA is constantly monitoring these drugs, even after they're approved, just in case any long-term effects pop up.
So after all of that testing and approval, we often see medications available under both generic and brand names.
Right.
What's the deal with that?
That's a common question.
Is one better than the other?
Generic and brand name drugs, they have the same active ingredients, they work in the same way, they have the same dosage.
Okay.
The main difference is usually the price.
Okay. Generics are often much more affordable.
Yes.
So if I'm looking at my inhaler for asthma, and I see Proventel, but then it also says albuterol sulfate.
Yeah.
So albuterol sulfate is the generic name.
Exactly.
Proventel is the brand name.
Yeah.
But they both have the same active ingredient that help me breathe.
Exactly.
Think of it like clothes.
Yeah. You could buy a designer shirt
Yeah.
or a similar shirt from a department store. They're both serving the same purpose.
Right.
But one might be pricier because of the brand name and marketing.
That makes total sense.
Yeah.
Now let's talk about all that information.
Yeah.
That comes with each medication. You know, the leaflets,
Right.
the instructions.
Uh-huh.
They can feel overwhelming.
Yeah. It's important stuff, though. It tells you what the medication's for,
Right.
when you shouldn't take it. Potential side effects.
It's like the user manual for your medication.
Yeah. Yes.
Let's break it down. We have indications. That's what the medication is approved to treat.
Yes.
Like our albuterol. It's to relieve and prevent bronchospasm,
Right.
that sudden tightening of the airways.
Uh-huh.
That makes it hard for us to breathe. Then we have contraindications.
Yeah. Contraindications.
Those are red flags. It's when you should not use a medication,
Right.
like a known allergy, or some other medical conditions that could get worse if you take this particular drug.
Yeah.
And finally, we have warnings.
Yes, the warnings. This is all about potential side effects or interactions to watch out for.
Right. Some might be mild, others could be serious, so it's good to be aware.
Yeah. And it's always best to review this information carefully
Right.
and discuss any concerns with your doctor or pharmacist, being proactive and informed about your health.
Okay, now this is where it gets intriguing. Off-label use.
Off-label use. When a medication is prescribed for something other than its FDA-approved use,
Is that allowed?
it is. Doctors can prescribe medications for other purposes, based on their professional judgment, the latest research, and what they think is best for that individual patient.
Okay, so it's like finding a new use for a tool.
Right.
Medications can surprisingly help with conditions that they weren't originally intended for.
Sometimes, yeah.
Like, for example, albuterol. It's mainly used for breathing issues, but can be used to treat high potassium levels in the blood.
That's right, because albuterol can, in some cases, help to shift potassium into cells,
Right.
which temporarily lowers those levels. in the bloodstream.
Right. But off-label use should always be discussed with your doctor.
It should.
Transparency is key.
Yes.
Now, what happens when someone takes multiple medications? Could they interact with each other?
They absolutely can. And understanding these drug interactions is crucial. Sometimes those interactions can be beneficial.
Okay. They can create a synergistic effect.
Synergistic effect, where the combined effect is greater than the sum of its parts.
Like a dynamic duo working together.
Yeah, 1 + 1 = 3.
1 + 1 = 3. To tackle the problem more effectively. But some interactions can be harmful.
They can.
Leading to adverse reactions.
Uh-huh.
Or reducing a drug's effectiveness.
Right.
That's why it's important to tell your doctor about everything you're taking.
Everything, even over-the-counter.
Over-the-counter meds, supplements, herbal remedies.
The whole thing.
Speaking of adverse reactions, what exactly are those? Is it the same as allergies?
Not exactly. An allergy is a specific immune response to a substance. An adverse drug reaction is any unwanted or unexpected effect. That happens when taking a medication. It can range from mild like tremors to severe like fluid in the lungs after taking epinephrine.
So the whole spectrum of possible effects, some predictable, others surprising. Sounds like you should be paying attention to your body and reporting any unusual symptoms to your doctor.
Absolutely. The sooner you catch a potential problem, the better. Now let's talk about how drugs target specific areas in the body. And this is where selectivity comes in. Okay,
I'm picturing a dartboard. A selective drug would be like a skilled dart player.
Hitting the bullseye every time.
Hitting the bullseye every time. So
selectivity.
Right. Refers to a drug's ability to bind to a specific receptor in the body. Think of receptors as tiny docking stations on cells where drugs can attach and exert their effects. The more selective the drug is, the less likely it's going to cause an unwanted side effect in other parts of the body. There's about precision targeting, minimizing collateral damage.
Precisely.
Right.
Now let's take a journey through pharmacokinetics.
Pharmacokinetics. It sounds complicated.
It sounds complicated, but it's just a study of what happens to a drug from the moment it enters your body until it exits. It involves 4 main stages. Absorption, distribution, metabolism, and elimination.
So it's like tracking a package as it travels to its destination. First, it needs to be picked up. Then it's transported. It's processed. Then it's delivered.
You got it. Absorption is how the drug gets into your bloodstream. Distribution is how it travels throughout your body. Metabolism, which happens mainly in the liver, is how your body breaks down the drug. And finally, elimination is how the drug leaves your system, usually through urine or feces.
So each stage is crucial.
Absolutely.
For the drug to do its job effectively. And the efficiency of each stage can be affected by things like age, genetics, liver, and kidney function, even other medications you're taking.
Right. It's a complex interplay.
Let's talk about a drug's half-life, which is the time it takes for the drug's concentration in the body to decrease by half.
Right.
This seems important for figuring out how often you need to take the medication.
It is. A drug with a short half-life needs to be taken more frequently to maintain its effect. Albuterol, for example, has a half-life of 2 to 5 hours, which is why you might need to use your inhaler several times a day.
So a longer half-life means less frequent dosing, more convenient for patients. It's like a slow-release fertilizer versus one that you have to apply every week.
You got it. But it's a balancing act. Doctors carefully consider a drug's half-life when prescribing it to make sure it stays effective without building up too much.
Right. In your system. And unfortunately, we need to talk about overdoses. Which happens when someone takes more medication than their body can handle.
Overdoses can be accidental or intentional, and their severity depends on the drug, the amount taken, individual factors like body size, and any existing medical conditions.
The symptoms can vary widely, too, from nausea and vomiting to seizures, difficulty breathing, even coma.
It's a reminder to always store medications safely.
Right. And follow those dosage instructions carefully.
And if an overdose is suspected, seek immediate medical attention.
Of course, time is critical. Treatment often involves inducing vomiting, administering activated charcoal, or using antidotes like naloxone, which reverses the effects of opioid overdose.
Exactly.
Prevention is the best strategy, though.
Absolutely.
Talking to your doctor, understanding those potential risks, storing them properly, all can go a long way.
Knowledge and awareness are powerful tools when it comes to medication safety.
Let's move on to medical abbreviations.
Yeah, they can seem like a secret code.
They can, but they're essential for clear and efficient communication among healthcare professionals. Like QID, we can mean 4 times a day.
Right.
Or Q4H, every 4 hours.
Every 4 hours.
PRN, as needed.
As needed.
But some abbreviations can easily be misinterpreted.
They can.
Which could lead to errors, like the abbreviation QD for once a day was often confused with QOD, every other day.
Right.
That's not a mistake you want to make when it comes to medication.
That's why the 6 rights of medication safety are so crucial. They act as a checklist to ensure accuracy and prevent errors.
Think of it as the golden rules of medication administration. The right drug, the right dose, the right patient, the right time, the right route, and the right documentation.
Each right is a vital step in preventing medication errors.
It's like a safety net for patients. And a reminder for healthcare workers to be vigilant and attentive to every detail.
Exactly. Speaking of details, let's zoom in to the molecular level.
Okay. And talk about receptors.
Yes, receptors, tiny sensors on cells where drugs bind and work their magic.
So receptors are like the keyholes you mentioned earlier.
Exactly. And drugs are the keys.
And drugs are the keys.
That fit into them.
Okay.
And there's 2 main ways that drugs interact with receptors as agonists or antagonists. Agonists activate receptors, triggering a response.
So an agonist is like turning on a light switch.
A great way to think about it. Albuterol, for example.
Okay. Is a beta-2 agonist?
It binds to beta-2 receptors in the airways, causing the muscles to relax and the airways to open up.
Okay, what about antagonists?
Antagonists block receptors, preventing other substances from binding and activating them. They're like putting a piece of tape over the switch to prevent it from being turned on.
So it's like a competition for the receptor site?
Exactly. Are there any examples of antagonists?
Yeah, are there any examples of antagonists that are used in respiratory care?
Beta blockers are a good example.
Okay. They block the effects of adrenaline on beta-adrenergic receptors, slowing down the heart rate, lowering blood pressure.
They can be helpful for certain heart conditions, but might not be suitable for everyone, especially those with asthma.
Okay. As they can potentially worsen breathing problems. It's fascinating how these microscopic interactions can have such significant effects on the body.
It is, and understanding those interactions is fundamental to how we develop and use medications effectively and safely.
Now, this brings us to pharmacodynamics.
Pharmacodynamics.
Which sounds a little intimidating.
It sounds a little intimidating, but it's simply the study of what drugs do to the body.
Okay, and how they do it. Think of it as the mechanism of action.
Yeah.
The step-by-step process of how a drug produces its effects. So we know that albuterol binds to beta-2 receptors. But pharmacodynamics helps us to understand the whole chain reaction that happens after that binding, ultimately leading to the relaxation of airway muscles and improved breathing.
Exactly.
It's like following a recipe. You need to understand each ingredient.
And step
To create the final dish. Pharmacodynamics helps us understand the recipe for how drugs work.
That's a great analogy. So pharmacodynamics helps us predict how a drug will work, identify potential side effects, and even design new and more effective therapies.
Okay, it sounds like we've covered a lot of ground in this first part.
We have. We've only just scratched the surface
of our deep dive into pharmacology for respiratory diseases.
There's so much more to explore.
Stay tuned for part 2, where we delve deeper into the specifics of various medications used in respiratory care. We'll discuss important safety considerations and explore the future of pharmacology for respiratory diseases.
It's going to be an insightful journey, so don't miss it.
And that wraps up another episode of Deep Dive Med. We hope you found this deep dive insightful and engaging. Don't forget to like and subscribe to the channel so you don't miss our next episode. For more exclusive content, check out our Patreon below for details. See you next time.